Well, you all know we love talking about wellness on the show, and today I'm going to introduce you to Dr. Vivek Soham. Welcome to the show.
Thank you for having me.
I'm really excited to talk to you because I was looking at these notes. There's a lot of words and acronyms that I'm not familiar with, so I'm guessing a lot of people at home are going to learn some new stuff today. So what exactly is NUCA care?
Yeah, so it's actually NUCA.
NUCA, see, I told you.
You're good. And so NUCA stands for the National Upper Cervical Chiropractic Association. It's actually a very specific technique for the upper part of the neck. So we look at how the head and the neck sit in relation to the entire body. In particular, looking at the brainstem. And your brainstem controls your heart, your lungs, your gut hormone balance, auditory, visual, you name it. Your brainstem controls all these things, and so we actually evaluate your whole body and use this to help alleviate people from certain symptoms and pain.
Okay, so you have two locations right now, one in Ocean Beach, one in Carlsbad, right over there on Avenida Encinas, and there's a third on the way, so people can easily get to you. What are some of the reasons people are coming into you from the beginning? Yeah,
so I would say about 80% of our office is headaches, migraines, vertigo, and hormonal imbalances. So it doesn't exclude a lot of the other things that we take care of. TMJ, POTS, concussions, and TBIs are also a lot of things that we do see. But yeah, I would say headaches, migraines, and vertigo would make up the majority of our office.
I'm noticing a trend where a lot of people are kind of seeking care before there's a problem. They want to go get scans and see if they're in good shape. So are there things that we can do that are preventative to come in, maybe try to get you before those migraines start coming on?
Yeah, so we actually take 3D imaging of the head and neck, which is also unique to our technique. In particular, the way that we sort of work and operate, there's no twisting, popping, or cracking. So a lot of people, when they assume that's chiropractic, it's a really gentle approach. So even if someone is coming in for preventative care, there is no risk of any other sort of damage or issues being caused.
This has to be a really exciting time to be in your field and specifically in your shoes because technology is just constantly evolving. So what things are you really excited about when you think about the future of your clinic?
Yeah, we've got, not just with the expansion of us growing into that third location, but we're working with a lot of different organizations, sports teams, currently working with a number of military individuals like the SEALs, just how much work and research that we have. We track everything meticulously, so it's really cool to see the befores and afters. There's no guessing with someone's health. We know where they're designed to be, and we actually take them to that point and create as much independence as possible.
I'm really interested in the athletic component because so many of these athletes, I mean, it is so competitive at such a young age, and I think about the damage that they're doing to their bodies if they're not taking proper care of it. So any advice for parents? Maybe they need to get their kids in to see you during the off season or between practices.
Yeah, the best thing is off season. Even with our, like from our elite athletes, from our NBA players, our PGA Tour golfers to like our weekend warriors, I would say off season is the best to get your body and your brain balanced so that you can learn to play with that, recover, and then go into the season focusing on actually performing than trying to recover or make those larger tweaks during the season. But preventative, understanding if they've had a history of concussions or TBIs, really important to get that taken care of sooner rather than later.
Let's talk logistics for everybody. We're about out of time, but I want to make sure people can come in and see you. So what's the best way to either schedule that appointment or prepare to pay for it? Are you accepting insurances? What do we need to know logistically?
Yeah, so you can give us a call. You can go online and book a consultation call. We have a hard policy. We don't take patients we can't help, so that consultation call is free. The exam takes about 45 minutes. We don't bill insurance directly, so HSA, FSA, we accept those as well as obviously cash payments as well, but we make everything as affordable as possible.
Okay, wonderful. Well, we kind of alluded to it at the very beginning of our conversation, this third location. Anything you can reveal? Do you want us to know where it's going to be, the time doors may open, or are you going to keep that a secret and come back?
Doors are already open. We're officially launching in probably in the next 3 to 4 weeks. But yeah, Beaverton, Portland, Oregon, we'll have our third office here shortly.
Okay, wonderful. Well, congratulations on all of your success, and you're welcome back anytime.
Thank you.
All right, speaking of wellness, we're going to take you out to the back lot to meet some local young athletes next.